Welcome back. There's a lot of information coming at us daily about the COVID-19 vaccines, and with that, facts versus fiction can sometimes get a little blurry. That's why True Health New Mexico decided to host a webinar that's to help clear up some confusion. Crystal spoke with Dr. Mark Epstein, the president and CEO of True Health New Mexico, to answer some of the common questions that they're getting.
Joining us this morning, we have Dr. Mark Epstein with True Health New Mexico. Good morning.
Good morning. Great to be with you.
Thank you so much for joining us this morning. We're talking about COVID-19, but also COVID-19 vaccinations. I know there's been a lot of information coming at us daily. So you've decided to, with True Health New Mexico, host a webinar this past week. So tell me about what you've learned so far, just from the webinar, but also what are some of the big concerns New Mexicans are feeling?
Well, there's just a lot of information out there, and folks really want to understand how do we sort through reality, facts, science from all the other messages out there. So people want to know, should I get the vaccine? How long is this going to go on? Do I continue to wear a mask? All these questions were really top of mind for folks participating.
Absolutely, and some very valid questions that you just gave us. Let's start with the most consistent question that we keep hearing. Should I get the vaccine?
Absolutely. First of all, everybody's individual situation may be dependent and worth a conversation with your own clinician if you have significant historical issues. Nonetheless, across our communities, across our state, it is really important that we all get in line, get registered, and get that vaccine, because that will help diminish the spread of the virus and get us back to what we hope to be a normal life going forward.
You know, a lot of people are wondering, like, where are we at as a state when it comes to the vaccine rollout?
You know, New Mexico is doing exceptionally well. We're third in the U.S. in terms of our rollout, and that's great. That means people are registering, the vaccine is getting to New Mexico, and New Mexicans are getting it in their arms. Is it perfect? No. Could we have more? Yes. Could we have it all tomorrow? Absolutely. But relative to the other states, we're doing very well.
You know, most people are under the misconception that they shouldn't register now because it's only for healthcare workers or for the elderly. Should they start registering?
Absolutely. It's worth getting your name on the list, so when the supplies pop up and your name is there, you're ready to go. So there's no reason to wait whatsoever.
So let's dive more into that webinar that you guys just hosted. You mentioned before that you guys had great participation, a lot of questions that were asked. What was the top question that you were asked?
Well, again, is the vaccine safe? Folks have been kind of amazed how quickly it's gotten to people's arms. And the answer there is absolutely yes. We always need to weigh as individuals the risk of not getting the vaccine versus getting the vaccine. And in most of the people, the vast majority of people, it makes sense just to get the vaccine. But we also need to consider it in light of our ability to spread the virus if we don't have the vaccine. So taking care of our family and friends and our communities by getting vaccinated is really important as well.
You know, another big question that you had mentioned earlier that you guys are receiving is, do I still need to wear a mask after I get the vaccination? And if I do, why should I get it if I can't go back to a normal life?
A great question. You know, the medical science doesn't have the precise data yet in terms of whether if you've been vaccinated, whether you are able to transmit the virus to somebody else, even though you may yourself not get any disease from it. That question is still out there, and we'll get more information as we go. So safety first, you know, yeah, wear the mask for now until we have better data to know that it's safe to move forward and start to relax our standards there. We're not there yet, but it is important.
You know, we've heard that, yes, you get the vaccination, you still have to wear the mask, but it reduces the chance that you'll have a severe outcome if you do contract COVID.
Absolutely, and that sometimes gets overlooked, so Crystal, thanks for bringing that up. In fact, it's not just about preventing ever getting infected. It's if you still do get infected on a rare occasion, the disease that you get from it, the outcomes, the symptoms may be much, much less because you've had the vaccination.
You know, a lot of people are also wondering about the symptoms because we've heard that the first shot may not be as bad as the second dose for especially the Moderna. Tell me about the symptoms that you guys are seeing, from, you know, chills to fevers to headaches.
Certainly, after the vaccine, it's not unusual to have some soreness in your arm where you've gotten the vaccination, perhaps some chills, headaches, muscle aches, and those usually are very limited in time, 1 to 2 days. They generally are not dangerous at all. You certainly don't need to be seeking medical care for them, just the usual kind of Tylenol and rest patterns to take care of yourself. That is an indicative that your body is actually mounting a response, which is great. That's what we want to see happen.
So that's a positive if you do get some type of symptom.
Yeah, it's normal. It's indicative of a response, and it's worth noting that if you don't have any response to the vaccine, you're still doing fine. That doesn't mean it's not working.
You know, I know a lot of people have been wondering about just registering in general. Should they register other people in their family if they're not able to access the website or understand how to kind of go through the website?
Absolutely, and folks at the Department of Health are there to help out, but we want to get as many people registered as possible to make sure that we know what the demand is and get the supply out there and get people, get vaccines in people's arms as quickly as possible.
You know, Dr. Epstein, you've answered some great questions for our viewers this morning, but I know they're going to have a lot more. You've just done the webinar. Where can they find it?
Well, great question, Crystal. It is on our website at truehealthnewmexico.com. And we've recorded it, so there are a lot of questions there, really wonderful questions from the community. So you'll get your questions answered, and if not, there's a place to email us some further questions.
Perfect. Dr. Epstein, again, thank you so much for joining us this morning.
Appreciate the time, Crystal.